for those patients who have stage 1 HER2 positive disease, we know that they are still at an increased risk of recurrence compared to patients who have HER2 negative breast cancers. So some retrospective series do suggest that these patients have a risk of recurrence that ranges somewhere between 10 to 30%. And so the challenge had been that these patients had been excluded from the pivotal adjuvant studies where they were not included, for example, in the NCCTG B31 trials and predominantly excluded from BCRG-006. And so we really didn't have data about what to do with these patients. And so the APT trial looked to originally give less chemotherapy to these patients. So it was really looking to see if giving a year of paclitaxel and trastuzumab was associated with a clinically acceptable event rate. And so that trial now with 7 years of follow-up has shown that that TH regimen is associated with a 7-year recurrence-free interval of 97.5%, really demonstrating that very few patients with stage 1 HER2 positive cancers will recur after giving the TH regimen. The more recently presented trial, the ATTEMPT trial, looked to see if we could potentially de-escalate therapy even further, to see if we could give a year of TDM1 instead of giving the TH regimen, and look to see if the year of TDM1 was associated with the clinically acceptable disease-free survival, and then look to compare toxicities between TDM1 and TH. And this study demonstrated with 3 years of follow-up that a year of TDM1 was associated with about a 98% 3-year disease-free survival, with only 2 patients in the trial out of the 375 on the TDM1 arm that had metastatic recurrence. So very few events in that arm in general. However, when the trial then compared rates of clinically relevant toxicities between a year of TDM1 and the TH regimen, it found that technically the rates of clinically relevant toxicities were actually identical in the 2 arms, so 46% in each arm. And so while I think overall the studies suggest that TDM1 is associated with a very good event rate and would be a very reasonable treatment regimen, technically did not show that it had fewer toxicities than TH. However, I think it's important to note that when looking at patient-reported outcomes, we did see that quality of life was actually better in those patients receiving TDM1 compared to TH, and there was less hair loss and less neurotoxicity. So I think there are differences in toxicities between TDM1 and TH, and I think it's important to factor those toxicities in when making decisions for your patients who have stage 1 HER2 positive cancers. So for example, if you have a patient who has underlying neuropathy, you might want to consider a year of TDM1 compared to TH in that particular patient. But I think we have to acknowledge that the trial did show also that the patients in the TDM1 arm, there were 17% of patients who didn't complete a year of TDM1 due to toxicities, very similar to what we saw in Catherine. And so that those patients at time of onset of toxicity went on to receive trastuzumab. And so if we are giving TDM1 for our stage 1 HER2 positive patients, if they run into challenges with toxicity, we do need to think about shifting them over to trastuzumab to complete their year of treatment.